My name is Ken Carswell. I'm from the Department of Mental Health and Substance Use at WHO in Geneva. And I'm going to talk to you today about a psychological intervention we developed called Self-Help Plus, as well as another part of Self-Help Plus, which is called Doing What Matters in Times of Stress. I'm very honoured and pleased to be here talking to you all, because the reason why we're talking to you about this is we've taken Self-Help Plus and translated it and adapted it, or the WHO country office in Ukraine has adapted it and translated it for use in Ukraine. And this work started, I think, probably in about April. I think we started work on doing the translation, and we worked on translating the whole package. And then in June started a rollout in Ukraine, so doing sort of multiple training of trainers, exercises of multiple different events to try and support the scale up and use of Self-Help Plus. So it's very good to be sharing this information with you. I'm going to be talking to you a bit about what Self-Help Plus is, and Galyna will be focusing more on the work in Ukraine. So tell you a little bit about what Self-Help Plus is and why we developed it in the first place. If we look at the sort of scientific literature, we know that there is a growing evidence base that what we call scalable psychological interventions can be very effective. These are interventions that can be delivered by non-specialists, and they tend to use fewer resources. Now, I'll tell you a little bit what we mean by scalable intervention in a moment. But what we do know is that these interventions, which are shorter than support that you get from a specialist, can be delivered by non-specialists in many different ways, using guided self-help, using briefer models of CBT, of cognitive behavioral therapy, and so on. And we started developing some of these interventions at WHO because there's a very good evidence base for them, but actually getting access to the manuals can be very hard. So people might complete randomized controlled trials on them, but then if you want to implement the actual intervention, it's hard sometimes to find it. So at WHO, we decided to work with many partners to either publish existing evidence-based interventions or come up and then test in randomized controlled trials different types of interventions. So when we talk about what the scalable psychological intervention is, on the left here, we have what a more conventional intervention is, and that's delivered by specialists, often for one problem like depression or anxiety or PTSD, usually many sessions, and it often requires some form of diagnostic assessment. When we think about more scalable interventions, they usually have some form of innovative delivery, so less reliant on specialists. It may use community workers, undergraduates, people like this, or it may use some form of self-help guide. Usually there's one type of intervention for many problems. They may require fewer sessions, and there's often a focus on skills for self-management. Now, something being scalable is not it's not a one or the other. It's not binary. Instead, it's more on a continuum. And here we can see a continuum of resource intensity and to some extent how scalable something might be. Down at this end, we have the most scalable intervention, which is giving out a self-help book or giving access to some sort of self-help app. And at the other end, we have the more resource intense interventions or less scalable ones, which are things like specialist delivered interventions. And in the middle, we have, going from the left, guided self-help, which may be delivered online or through a book, or maybe through a group, as we're going to talk about today. We then have sort of group delivered interventions. So this may be delivering sort of a brief 5-session model that is based on cognitive behavioral therapy to a group. We then above that have multi-session individually delivered interventions. So we can think about all types of psychological counseling and interventions being on this continuum. And today we're talking about an intervention that is more down the end where I've circled it red. And this intervention is called Self-Help Plus. So I'll go through a little bit what Self-Help Plus is. So it's a brief guided self-help psychological intervention. Now, when we say guided self-help, we're talking about that the person is given something to help themselves, but at the same time, there is somebody there, like a trained facilitator or helper, to guide them, to motivate them, to encourage them, to answer any questions. So the facilitator is not giving any form of counseling or any form of psychological support. They're just there to help run the group and help make sure that the self-help information is communicated clearly. Now, the Self-Help Plus intervention is based on something we call acceptance and commitment therapy, which is a modern form of CBT. And we developed it over about 6 years at WHO with many partners. The important aspect about Self-Help Plus is that it uses a pre-recorded audio. So instead of the facilitator being the person who explains all the information, all of the information comes from this pre-recorded audio, which is about an hour long per session. And the audio sort of explains everything. It sort of says, you know, welcome to this course on managing stress. It gives an explanation about what stress is. It tells you some of the techniques. And the role of the facilitator is to play the audio, stop and start the audio, but also run discussions, make sure that people are engaged, make sure that people are safe by ensuring that if anybody is distressed, the facilitator will give them some support and help them to use some form of stress management technique. The second part of Self-Help Plus is an illustrated self-help book, which I'll talk about a bit more in a minute. Now, Self-Help Plus is delivered over 5 weeks in sessions that are between 90 minutes to 2 hours. And it's for about 10 to 30 people per group. So it can be used as quite a small group or quite a big group. And we've run this now in a number of places, and we've run a number of research trials on it using briefly trained non-specialists. Now, this doesn't mean that specialists cannot do this. Specialists could still use this course if they wanted to, but we also know that non-specialists can use it. And certainly probably a better use of resources is if we have non-specialists deliver this, who are then supervised by a specialist who can also then see people who might need more support after doing a course like this. So a bit more on what is Self-Help Plus. What you can see here in English and Ukrainian are the 5 core strategies. So the first one is grounding, which is very much about a stress management approach. The second is called unhooking. So this is a cognitive technique about how you unhook from difficult feelings by more or less saying to yourself, I notice that I'm feeling sad. So you say, I notice, and you say the emotion. So that's a form of unhooking. The third section is about acting on your values. So one of the things we know from this type of therapy and this type of approach is that if you act in accordance with your values, it's going to reduce your stress and improve your mental health. The fourth section is about being kind. So kindness both to yourself and kindness to others. And the fifth one is called making room, which is really a technique that builds on all the other techniques and is about how you deal with very painful and difficult situations. And one of the core parts of Self-Help Plus is that it was designed for use in emergency context, humanitarian context, and similar, and particularly places where stress is high, but also where people may not be able to change the situation they're in. So they may not be able to leave the situation, they may be in danger, and so on. And part of the thinking behind Self-Help Plus is the idea that even if the situation is still very difficult, there are still small things that you can do in your life on a daily basis, which can help you, can help others around you, and can help to reduce your stress. Now, the easiest way I'd say to get to know Self-Help Plus would be by reading the illustrated book. So we have Self-Help Plus, and then we have something called Doing What Matters in Times of Stress, or DWM. And DWM is actually the book from the Self-Help Plus course. And it's basically a brief, illustrated, easy to read guide. And it summarizes all of the core information from Self-Help Plus. So this is a very easy way to get to know Self-Help Plus, to get to know some of the content and the work within it. And you can download this at the WHO website. And I should also say that Self-Help Plus can also be downloaded at the WHO website in Ukrainian, both the audios and the manual itself. And if you just type in Self-Help Plus WHO, you'll likely find that through Google. Now, the third part that we have is that the Self-Help Plus book, Doing What Matters in Times of Stress, has, by the VU University in Amsterdam, with some support from ourselves, been turned into a web app, so a web application. So this is a bit like a smartphone app. You need to have constant internet to use it. Unfortunately, you can't download it, but it works very much like an app. And we now have it available in both Ukrainian and English. And you can see the website there, dwmmatters.eu. Now, I'd say this is a big improvement on the self-help book, because what it does is it takes the same content and it displays it obviously through your computer screen, but we've also included in there some motivational components. So some things in there to help people reflect on what they want to get out of using the app. And we've also put in some audio exercises. So it's much easier to use because you can just listen to the grounding exercise audio through your phone. And hello. Oh, and we can also, it's also been designed to be very private and confidential. So there is a login screen because we need to use a login screen to make the software work, but it collects very, very, very limited information. As I remember, you just need to put in a username and make up a password. So it's not collecting much information or anything like that. We've designed it really with that in mind. So that's 3 parts of Self-Help Plus. We have the audio course and the group, we have the book, and we have the book that's been turned into a web app. So just to give you a little bit of background on how Self-Help Plus was developed, it was developed over about 6 years. We worked with somebody called Dr. Russ Harris, who is a best-selling author of a self-help book called The Happiness Trap. And he was the author of the Self-Help Plus course, and he wrote it with us at WHO. We then did some initial work to develop it, to adapt it, to check how it worked in Syria and in Uganda, and we then revised it. Then after revising it, we did an uncontrolled pilot with about 30 people in Uganda, and we did some qualitative process evaluations after that. And again, we improved it and revised it based on that research. We then had our first randomized controlled trial in Uganda, and again, improved it after that. And finally, we had 2 big randomized controlled trials in multiple European countries and 1 in Turkey. And we did a final revision of the whole course, improved it, shortened it, made things easier for the facilitator, made it more engaging, and then we published the Self-Help Plus course. So a lot of work has gone into making this as engaging and accessible as possible. So just to give you an idea of where Self-Help Plus has been used, we did our first randomized controlled trial in Uganda. And then, like I said, we had a second trial in Turkey. And then we had a multi-site randomized controlled trial that involved people in Austria, Finland, Germany, Italy, and the United Kingdom. I'll show you this in the research section, but it's been primarily used in research studies with refugees from multiple contexts. So these are people who are asylum seekers or refugees, and the vast majority had undergone very difficult situations, including conflict, adversity, having to leave their homes. But it's also been used a bit more widely than that now. I mean, it's now being used in different health settings. We would get emails from people in the UK asking for it to be used. So it sounds like it's now being used quite widely. In terms of implementation, it's been implemented in Uganda. And as Galyna will tell us about, it's also been implemented now widely in Ukraine. So just a little bit about the research. And I'm going to be very quick here with the research, because if you want to know more about it, I've added the name of the paper and the publication, and you can download the research paper if you want to look at it more. So in our first randomized controlled trial, we wanted to understand if Self-Help Plus was more effective than what we call enhanced usual care in reducing psychological distress among distressed female South Sudanese refugees in Uganda. It was a custom randomized controlled trial. So we had 14 villages, and half of them got Self-Help Plus and half of them got enhanced usual care. And it included about 700 people. At the end of the study, we found that people who got Self-Help Plus had significantly better outcomes in psychological distress. And this is what we call a moderate effect size straight after the intervention. And then it declined a little bit. So at 3 months, the stress levels of the people who had received Self-Help Plus had increased. So we're now thinking about, well, how can we help people to continue practicing Self-Help Plus? Because we think that probably will be protective and will be helpful in reducing their stress. We also saw many significant outcomes across the other secondary measures, such as depression, anxiety, PTSD, functioning, and well-being. In our 2 second trials in Turkey and European countries, we wanted to ask the question, is Self-Help Plus more effective than enhanced usual care in preventing the onset of mental disorders among distressed refugees and asylum seekers, in Syrian refugees in Turkey, and then in multiple groups in Western Europe? So you can see here the question was a bit different. Here we were asking, if we have people who are already very distressed, gone through a lot of difficulties, does Self-Help Plus stop them from developing a mental disorder or stop them from getting worse? And so it was a very different research design. This was a randomized controlled trial on an individual level. It was refugees and asylum seekers, and people had to score above a cutoff on distress, but then they also got interviewed, did a diagnostic interview, and they had to have no mental disorder at baseline. We had about 450 people in Europe and over 600 in Turkey. And this was interesting because we got slightly different results. In Turkey, people were significantly better at post-intervention, but 6-month follow-up, those benefits were lost. So people got better at first, and then weren't, by 6 months they were equal again. In Turkey, which was with Syrian refugees, we found that people were not different at post-intervention, but 6 months later, the Self-Help Plus group had around half the risk of developing a mental disorder compared to the control group, which in this area of prevention research is quite a big finding. Now, we're not sure exactly of the reasons for these slightly reversed findings, but we think it could be to do with the groups that we were working with, the countries, the access that people had to resources. But when we look at the 3 trials overall, we see that it is a bit difficult to compare some of the things between the trials, but we do see good effects from Self-Help Plus. We see moderate effects in Uganda. We see people reducing stress. We see some protective impacts on the risk of mental disorders. And we see roughly Self-Help Plus being very consistent with other similar Self-Help Plus groups. So there are other groups like Self-Help Plus that have been run for many years in European countries. One of them is called Coping with Depression. And we see a similar level of effect, a similar amount of power with it. So we're confident that it works. We're confident that it's a meaningful approach, but obviously it's not enough. You know, we can think that Self-Help Plus is a very good intervention for many people, and it might even help people who are quite severely distressed to get less distressed. But there's going to be a need for more support for people as well. So I'll talk a bit about that now, and in terms of how Self-Help Plus can be used. So as I mentioned, it can be used in large groups or small groups. I think one of the benefits of Self-Help Plus is that it can be given to many, many people at once, and it's very flexible and adaptable. And it can be used in different ways. It can be used with a group who are doing quite well to reduce their stress. It could be used with a group of people who are scoring quite high in terms of psychological distress to see how well this works first, before maybe giving an individual psychological intervention or something like that. So it's quite a flexible approach. And colleagues in Ukraine, we've never tested this at WHO, but when we were doing the training of trainers there was a lot of interest in doing Self-Help Plus online and running online groups. So I know that there's been some work on that in Ukraine, and people have been delivering it online as well. So that's Self-Help Plus, the group intervention. When we talk about doing what matters in times of stress, the app or the book, this can be used in two ways. The first way is that it can be unguided. So we can give out the book to many people, or we can give everybody access to the app. And we know that unguided interventions can be very helpful. However, we know that guided interventions are even better. And for a guided intervention for doing what matters in times of stress, that means giving somebody a brief 10 to 15-minute telephone call once a week to check in with them, to check in with how they're using the intervention. And we developed a manual like this at WHO for some of our other work. And this guided approach with the doing what matters has now been tested in a randomized controlled trial as part of the Respond project with the VU University. And we've seen some quite promising results. And there it's being used as step 1, you get the Doing What Matters app guided. And the step 2, you get a Problem Management Plus, which is a 5-session psychological intervention. So what we can see is that we can see different ways that Self-Help Plus and Doing What Matters can be used. And if we use it in some form of step care approach, or we integrate it into our other help, then hopefully we can see that we might be able to give more support to many more people, because we could give support to many people by giving 30 people a Self-Help Plus group. And then those people afterwards who still need some more help, then get some more help. And that way we can reach more people than giving everybody a lot early on. So I think you can consider Self-Help Plus and Doing What Matters in times of stress being used flexibly. Other support will be required. You can consider it in what we call stepped care. And as I mentioned, we're seeing some promising results. So thanks, everybody. That's my presentation. And hopefully we've got a bit of time for questions. Thank you.
Thank you. Thank you very much, Dr. Carswell. I think that we already have some questions in the chat. And I have as well a question, and I invite colleagues as well to think about ideas you have or questions you have, and as well you can put it into a chat. But I would like to give a small comment, because you know, one of those people who was waiting patiently when we will have Ukrainian translation of Self-Help Plus for groups were military psychologists. And I think that you were referring only to displaced people under stress, on the move. However, we've seen this during the first weeks and months after the war has started, that the main issue was a high level of stress, panic attacks, insomnia, somatic symptoms, anxiety, fear, etc. And still this is an issue. And yeah, we have actually in our room here several military mental health professionals. It would be really interesting and nice to hear their insight and your comment as well, Ken.
Yeah, maybe Irina, no, thank you for bringing that up. And that's something maybe I need to mention. When we developed Self-Help Plus, we developed it for populations affected by what we call adversity. So we developed it for people who are exposed to high levels of stress. So this is people who are affected by conflict. It could be people in the military. It could be people who are first responders, like, emergency services. It could also be people who are just experiencing ongoing stress, for example, poverty or very difficult living conditions or natural disasters. And we developed Self-Help Plus particularly to be adaptable for many of these different many different populations. So we would think that it would be suitable certainly for people who are in the military. Yeah.
Yeah.
Thanks for bringing that up.
And Olena is asking, is she right that she just can check this intervention on WHO website, read it, and then just deliver it as, for example, a psychologist, or she needs to undergo a special training for that?
So we'll put this in the chat. I'll put this in the chat just after the presentation. There's the WHO country office. We have a colleague there. We have many colleagues there, Galyna being one, but we have a colleague there called Natalia who is managing this. And there's been many, many trainings on Self-Help Plus throughout Ukraine. So you can contact the WHO country office, and I'll put her email in the chat. However, Self-Help Plus is very easy to learn. We think that some people can easily train themselves. So I think I'd encourage you to go online, have a look at the book, have a read through the manual, see what you think, and then you can contact also the WHO office if you need any more support. We also have a training manual in Ukrainian that's available on request. Now that hasn't been published yet because we haven't published the English version yet. So we need to do that first. But that's available on the request, I think, from Natalia or from Galyna or from other colleagues.
Mm-hmm. Yeah, thank you very much. Olena, do you still have question? Olena Kataeva, you raised the hand.
Yes, thank you. I did get the response to the question I posted before, but if I may, I would like to ask another one.
Sure.
I have been working in social services for some time, and I was trained on support group for parents who adopt children, and we worked specifically with that population, the parents who adopt children. But for Self-Help Plus, is there a requirement to have some uniform population so that they would have a similar stress level or something? Like, how much is the requirement of uniformity in the groups?
Okay, very good question. I would say the requirement of uniformity is not so much. So again, it was developed to be widely applicable. So you might have a group where there is some people who are very stressed, and there are other people who are not so stressed. Because it's self-help, it's about people listening and learning and applying it to their own life. So I think in terms of levels of stress, people can be different. I think, depending on the area, the culture, there might be reasons for having groups of certain makeups. But I think in that situation, to have a group where they have different levels of stress is okay. But you would have, I would trust that yourself and others could be a good judge of what would make a good group. But have a look, if you have a read through the group, and you'll see how it works, and I think you'll be very confident in making a judgment as to how to do that.
Yeah, thank you, Elena, for a question. We have two hands raised. The first was Professor Robert Ursano from US. He's a military psychiatrist. And Bob, please.
Thank you, Irina. Thank you, Dr. Carswell and Irina. Great program today. I'm impressed with the program, of course, and an alert to it. A couple of questions and a couple of thoughts. On the thought side, in terms of working with soldiers, service members, or even more broadly, during the acute stress experience, it'd be interesting to think through which elements of Self-Help Plus are most helpful and how they might be modified. Certainly one of its nice forms is it could be delivered to large numbers of people and by non-specialists, which is easy to fit into a military setting and think about prior to an event. The two questions arrive from that. One, I think I saw Marit also on, so she may have some thoughts on this one. How do you picture this Self-Help Plus working with Problem Management Plus? You know, where are the synergies and the potential conflicts? And then a broad comment. It would be wonderful in the perfect world if we could plot across a disaster or a war the across time measures of different emotions, such as high levels of fear and threat versus sadness and loss versus grief versus high levels of adversities needing to problem solve versus threat times. And if one could plot those across time, then I think the picture of which interventions at which spot in time become critical to us. I mean, clearly that's a wish, not something one could easily do. But the thought being that depending on which issues one's trying to deal with, both emotionally and problem-wise, our interventions are different. One footnote to that, we're very aware these days, because of the Ukraine, the importance of people being able to manage acute stress. And how does one manage acute stress, particularly when acute stress goes on for a long time? The name doesn't quite fit, but the experience does. So a couple of questions composed in a few comments, and appreciate the opportunity, Irina.
Right, thank you, Professor. So maybe I can respond a little bit, and then it would be interesting to hear Marit's thoughts as well. I think, how does it fit with PM Plus? Now, it's interesting because theoretically they are a bit different. Acceptance and commitment therapy is quite different to what we have in Problem Management Plus. And we were a little bit concerned about how that might fit together, but from what I understand so far, we haven't really seen any issues with it. I would say, though, that there's more work to be done. I mean, I think there's more work to be done both in terms of research and in terms of practical experience. And I guess our thinking here at WHO is that we've made these packages, we've got them out there, and then we hope that they're going to be used, researched, and can answer some of these questions, including this question of trying to plot things out. I think there's a lot of things we don't know the answer to. What I'd be really keen to see is we're starting to use the different interventions somehow mapped out together, which we're starting to do with stepped care. But then also what comes after that? What comes after having done, say, Self-Help Plus, PM Plus? What then happens if you still need help after that? So I think, or what happens if you've got substance use or alcohol issues? There's still a lot for us to work out there, but hopefully people can build on some of the packages that are there now.
Mm-hmm. Yeah, thank you very much. Marit, do you want to add something on that? Or
yeah,
maybe...
so definitely. So thanks a lot. Yeah, I think it's very actually very interesting point that you're raising, Bob, to actually plot the types of emotions people experience or cognitions, and then actually see what type of intervention we then have to offer. And we're not there yet, unfortunately, but I think that will be definitely very interesting to look at if we have more data. So Self-Help Plus is more focused on, in my opinion, but this is maybe Ken thinks differently, but it's more focused on handling acute stress or stressors. It's a preventive intervention. It has proven to be in Self-Help Plus to be able to actually prevent a disorder, which is quite actually great, because there are not that many interventions that really can prevent disorders. On the other hand, Problem Management Plus is more focused on handling feelings of inactivity. It's very much focused on behavioral activation. We're currently also having, we're adding a module with trauma exposure in it as well. We're at the moment evaluating that one, so we don't know yet whether it's effective. I think we're doing it in a stepped care format because Self-Help Plus is less intensive than PM Plus, specifically if you use PM Plus individually. Mm-hmm. So that's how I would see the two together. I would also be careful to do that for everyone like that, because then maybe some people it's too much and you can immediately start with PM Plus. So I think it's also a very contextual question. So what is actually the possibilities within an environment? Is it better to have a group intervention? Is it mainly focused on acute stress? Then I would use Self-Help Plus, but do you have the opportunity to see people face individually? probably easier to use PM+, I think.
Yeah, thank you very much. And Orest, I see your hand. Before I will refer to you, I just give a short comment. I know that because, sorry, I brought this totally different topic. You know, we were talking about forcibly displaced people and refugees, etc. And I just, refer to, but I know that military psychologists, because you are right, the thing is that the number of military in Ukraine increased in 4 or 5 times. So civilian psychologists now these days are called to support those civil people who became military. So that's the need. And I know that they use this as a preparation. You know, they teach people before they deploy how to cope with stress, how to manage it. And I've heard that especially those audio exercises are helpful. But we have here as well Andriy Karachevsky, maybe he can comment on that. And Orest, yes, please, let's hear your question or comment, and then we will proceed with Galyna and have discussion at the end again.
Дякую, мене чути добре?
Так.
Я буду українською, щоб
I
швидше.
think I will be asking the question in Ukrainian to make it faster. Thank you so much for the invitation and the fantastic presentation. I would like to give a few comments, because military service persons, sooner or later, they will become civilians again, and also community services have to be ready to this. And Olena raised the question of training, and I see how training is happening in Ukraine. It's great that the WHO and this group that Ken mentioned, they are teaching social workers from every region. There are at least 2 social workers in every region of Ukraine who are trained in self-help plus, and they are training others. And it's a very good architecture to strengthen the capacity of social services in Ukraine, because self-help plus is not something extra special. It's a good tool that essentially every social worker has to master. And in the Ukrainian context, we have certain specificity, because even now, when we see who is sent to these trainings, well, still mostly the communities are sending psychologists for this training, but we also want to train those frontline workers, social workers who face people daily, and they have to have these skills too. So scalability is a very, very good thing here. And thank you for having it translated in Ukrainian. And it's great that it's evidence-based. And I appreciate the effort it took to do it all. And Olena, who was asking the question, just check in your region, or maybe you can contact the WHO Ukraine country office. I think every Wednesday there is a meeting of these groups in Ukraine. You just have to stay in touch, and you can get all the information you need.
Yeah, great, Orest. Thank you for raising this. So please feel free to put as well link to the chat how our attendees, our mental health professionals, can join this MHPSS Ukraine group. I think it's really important to build this bridge.
Let me introduce while I'm sharing my screen. My name is Galyna Naumenko, and I am the professor at the Department of Psychosomatic Medicine and Psychology and Psychotherapy in the Bogomolets University. I'm also a psychotherapist and the WHO consultant. From the beginning of the war, we've started implementing self-help plus, and we were engaged in its translation and adaptation, and we conducted the first TOTs, and we did all possible to scale it up. So I will share my experience here, and I want to now make the slides full screen. Just a second.
I'm sorry for these pauses. Just a moment. Okay, while we're waiting, I'll repeat how everything was unfolding. the pace was quite high. When we began our work, we had only English manual, and all the preparation materials for the trainers were also in English. So we started adaptation without having a translated version at hand, and it all happened at an accelerated pace. Okay, the power is back, or oh no, the power is cut and I might disappear. Can you hear me? Can you see me
Yes,
now? Can you see
yes,
the presentation?
yes. Please don't disappear. Yeah. But this is happening. Okay, let's just wait for 30 seconds.
4 лютого усвідомили, що життя вже
On February 24th, we realized that things have changed irreversibly. And we wanted to promptly adapt to this new context and new situation. So how this happened? One time when you're out of breath, we need to find the energy within, and we need to find the energy to stabilize our breathing and to breathe deeper, to keep going. It was a difficult task, of course. And I always draw this parallel between that time in 2013 and 2014, the very onset of Maidan revolution, the very beginning of the Russian invasion. It just so coincided that I defended my PhD thesis, so I could divert my attention elsewhere, and that was very helpful. Self-help added sense at a time where full-scale invasion was launched. So this was alike to my work on my thesis, but with the aim to implement that en masse among people. So we found the energy and gradually got hold of the pace that was helping us after all. Before the war began, 1 week before the beginning of the war, actually, my colleagues and I don't know if there are other colleagues who listened to that. So we attended DWM as participants 1 week before the war began, basically. So we had more resources to pull ourselves together and to test them out personally. And we realized they were actually working. So during the initial weeks where we're hiding in shelters, in basements, basically, because we didn't know about all the opportunities back then. And I was using grounding a lot, and I used it for my family, and I used it in self-help mode. We had the audios, and together with the audios, we could practice it. Why are these exercises important? How did I personally found some that made sense? Why we wanted this accelerated adaptation? Because this helped us to identify the field of our personal control. What do we have control over, not to feel utterly helpless in the face of war? Before this full-scale war, before the hostilities, it was impossible to make any sense of that. So it was about refocusing our attention, what's in my power. I love this picture. It's not evidence-based, but I apologize before the academics. The picture says, I influence what I can't, I accept what I cannot control. So this is consonant to chapter 3, actually, of Self-Help Plus. And DWM is acting in line with your own values. We always repeat it and reiterate it as a prayer, as a motto. Like, yeah, accept what you can't control, or act when you can control. Oh, I even forgot how the line goes correctly. Maybe there's someone who help me. So acting in according to your own values. So it's impossible that you influence things that we can control and accept the things that are outside our control and act in line with our values. It's important that we are those people who take care of themselves in the first place. It's a typical characteristic of our nations, actually. We don't have that self-help culture. We don't have this idea of taking care of ourselves first. And it was a powerful message during the war. We needed to understand that self-care is a necessity, not a luxury. We need to traverse this long path, marathon, don't we? It's not a sprint. And we need energy. I'm really sorry. I hear some disturbance. Could you please mute yourselves? It's very hard to give a talk like that. Thank you. It was critical that we have the energy for this, to endure this marathon. So we started fostering this self-help culture. And we published the DWM book recently, and it's adapted in line with the manuals of WHO, the WHO guidelines that were issued during COVID. So we tried to adapt it to the new situations. We included some stories and narratives there. So it's a small win to spread these materials among the public so that they don't have any fear of contacting counselors and professionals. This is an innovative format, including the audio recordings. We were in serious doubts. I personally feared that people won't really appreciate it and won't embrace it, because there's always enormous resistance among our train of trainers, participants. We love talking, but my personal things that made sense for this audio recordings and how it was assistive. All of us are stressed, and we want to have something we can there's something that underpins our work, such as recorded audio. We can always rely on that. And things made sense because the trainer and the facilitator and the participants can help themselves. So it's a self-care opportunity and it's legal. Apparently, I don't have to sacrifice myself. I don't have to sacrifice my own energy. I can be there and then together with my participants. I can practice these techniques and I can show that that's effective. And it was effective indeed. And these are scalable interventions. The number of trainings that we deliver in this situation, it's wonderful help, because if you talk a lot and more than a certain amount of time, your voice is fatigued. So audio was of great help. And voice is our true friends. And it works in the reality that we're facing now. Okay, key senses that I see for myself. I list 4 points. Look at the picture. This is about probably abuse of diazepam and other medications. We have other self-help tools outside medications. So we cannot, of course, ban people of taking diazepam, but we can broaden their perspectives that there are other strategies and techniques and approaches. Self-help plus is indicative of the fact that it's an evidence-based technique. It's transdiagnostic, and as Ken mentioned, that there are randomized trials that have distress, depression, anxiety, and it's also good in preventing PTSD and other mental health disorder. It's scalable. Many people can learn self-help at the same time. So I can apply this tool here and now. Destigmatization. because the mental health professionals are no longer these monstrous people who prescribe some obscure medications. No, people see us differently now. We're approachable, we're accessible. People have less fear contacting a mental health professional than they did before. Another thing we emphasize is guided self-help is not a psychotherapy, and it does not replace specialized services. This actually drives the demand for professional help in mental health. Also, we're looking at the importance that the people who come and join our groups, they are under impression it's some sort of psychotherapy, but it's some low intensity resource. But as things unfold, we see how experienced trainers, psychologists, psychotherapists try to hold these sessions on their own, and we see the effect, we see the change in people. And this is indicated by the final feedback at the end of the training. This program is supported by the country office WHO and also is fostered by the National Program for Mental Health and Psychosocial Support initiated by the First Lady of Ukraine, Olena Zelenska, back in May 2022. So the public sector is engaged and the businesses are engaged, and they help to scale that intervention out and make it accessible. Narcissistic component here, of course, I wanted to include a tiny bit of self-admiration. I found a picture with Lydia. These were our trainers, and thanks to you, the program kicked off. And then we started spreading it. I found several group pictures. This is from the city of Lviv, and this was for the railway workers, and the photo below is from the city of Sumy. And these are business representatives. I won't list them all, but you can find it on WHO website. It's publicly accessible. I cannot help mentioning our WHO team that works in the field of mental health in Ukraine. And they are a robust support for each and every one of us. If it weren't for these people, it wouldn't have been possible. Their support was critical at every step of implementation of this manual. Feedback opportunities, feedback after the first group was delivered. Ken left, he couldn't be present there with us. Oleg, Alisa, Natalia, and our colleagues from other programs, and also multidisciplinary teams. So this aspect is critical. So how did we start? I won't dwell on it, won't dwell on every detail. So we worked on the package methodologically. We selected the voice for Self-Help Plus, and that was a very creative process, actually. And I moved temporarily to Lviv after the beginning of hostilities, and I was listening to different voices at night. Thanks God, those were recorded voices, and its support was critical. I could really try and understand what works, and I could test it out myself, what was effective and what wasn't. So the team selected the speakers, moderated the audio recordings, and then we also created the group course for managing stress. And then we also developed the train the trainer package. We adapted some of the sentences. So the outcome is not as perfect as we would have liked it to be, but we did our best anyway. It was crucial that we adapted the trainings. I remember our first meeting with Ken. So we wanted to do 1 day, 1.5 days for the trainers who have already covered DWM. And then we thought, no, maybe 3 days. or 4 days. It was a lengthy discussion. So we tried out all the options and then we ended up with 4 days. It's really a straightforward intervention, but every step of the way needs to be done together. We really need to think how we can adapt it to the local context. 4 days is the best, but there's more inquiry. Please do 5 days because this fifth making space intervention is missing. We scaled it to different target audiences. It's not just healthcare workers. And WHO is not only about working with healthcare professionals. We also included railway workers, the businesses, social workers. So it's an expanded effort. It was really about scaling. It was scalable. It's about making sense so that other people can make sense of us. So healthcare workers are not this unique caste or niche group. We're all the same boat and we need to help each other out. We support all participants during the delivery. We created a community that's already delivering the interventions. They have already completed their training. You can be a part of it if you want. And we are trying to support all our participants by providing supervision, 4 months supervision, in fact. And we support not only verbally, but also practically, so that the state provides some of the equipments, materials. So we're trying to give people tools and support them as they deliver it. But you can see the places where trainings can be delivered anywhere, practically. You can see shelters, you can see some nice rooms, conference rooms, but wherever we are, it was highly needed, it was effective, and participants commented how effective it was. And I was happy. I was the trainer and I was stable too. Why Self-Help Plus specifically? Every time we need to answer that question. It's accessible support. It's short-term. It helps to economize on the time for providing care. It's evidence-based. It has low resource intensity. And it can be useful when there's limited or no access to psychosocial services providers. Really, you can use it and you can spread this practice and you can be effective in engaging with one another. Look at the picture, by the way. It's one of the groups that we delivered to the Ministry of Social Policy professionals, and they started implementing Self-Help Plus. I couldn't include all the pictures. I think it's a breach of confidentiality, by the way, but actually we marvel at how each group is very creative about delivery. And these people show their creativity through different multicolored figures or balloons, or it all contributes to this tool being more accessible for their target audience. Who is the target audience? First, social field professionals, Ukrainian railway companies, for example, HR managers, the railway doctors, psychologists. We also did an online group, 1.5 days for groups who have already covered DWM, and also the barrier-free businesses are on the rise at the moment. Next week, we're doing a training session for the NGOs offices in Kiev and in Lviv. Finally, we got there. I know you've been waiting for us for a long time. And naturally, healthcare workers and professionals are a part of that effort. Program managers said that we've already trained in joint effort a total of 179 trainers. And we train the trainers first, and then these trainers teach other trainers who subsequently train facilitators. We do it to increase the coverage, the most part of Ukraine. You can see these results are stunning. And people in newly deoccupied areas such as Kharkiv region are already putting these interventions into practice. So therefore, we covered almost the entire territory of Ukraine with the exception of Kherson region. And these interventions are delivered both offline and online. What are the successful? It can be applied in people's private lives. It's important, and then they can communicate these skills to their nearest and dearest, and then they try themselves out as facilitators and trainers, because facilitating is really straightforward. Ken has already mentioned it before, and this is the slide from Ken's presentation. We need to keep the effect going, so this delivery needs to be consistent. Yeah, sustainable. Yeah. So it's critical that there are these Google app that Ken mentioned, DW matters. If you don't practice these techniques, they won't be operating. You can't use and you can't incorporate these skills in your new life. I would also like to mention the Better Me application. It was present to the World Health Day, 10th of October, not the best day. Better Me joined forces with an NGO, Bezbariernost, No Barriers, and it's an app it's based on DWM, and it can be uploaded on your smartphone. There's no need to have internet access. It has audio recordings, wonderful imagery that helps us to.
And with regards to the barriers, well, sometimes there's just bias and prejudice from the participants, because sometimes people just find it difficult to imagine that their life can be improved. They might have some prejudice to that. Or if you talk about specialists who had some experience of work in the social sphere or psychotherapy, they sometimes want to have more influence of the trainers. We've seen a lot of resistance, saying that we kind of disregard the importance of the trainers with this intervention. But we try to explain that it's like self-help, that it's just the modality, but usually this resistance is over by the end of day one. And we just have to explain to people that we are creating this space, and we will be creating this space during the supervision meetings, and then people take it. And we also need to acknowledge that we live in a stably anxious background environment, and I remember, interestingly, one of the participants said that, well, I first realized the importance of the grounding technique once we started having the blackouts, when you have to touch everything around you to find the torch, to find the phone. It really helps. So, yeah, even like the new realities, when there are blackouts, they provide fertile soil for example, the grounding exercise, when we can, for example, light a candle, especially if it's an aromatic candle, or grab a cup of hot tea, and then we observe how we drink, we observe how we get warmer. So it does help, and it's important that it's all very flexible and mobile. For example, if the air raid alert sounds, then we can go to the shelter. We can just take the recording with us and continue there in the shelter. It's great that it's whole adaptable and flexible, and that we as trainers, we are using these techniques, and we know firsthand that they work because we've experienced it all. And sense of humor, it's also a very important factor in overcoming stress. And we have certain victories here. The adaptation of the Self-Help Plus in Ukrainian during war, I think it's remarkable. It's also an important aspect of cooperation with the Ministry of Social Policies, for example. We managed to train quite a lot, and will have 5,000 facilitators by the end of the winter. And I was puzzled first when we talked about having these interventions for the businesses, but it was my own stigma. And after we started implementing it, I saw that it really is needed for the businesses, and then HR managers are really interested in the implementation of this, and they actually have less barriers in the implementation because they have more resources. Yeah, the cooperation with the Better Me application was useful, and it really is inspiring when we see our participants implementing things online even before we explained it, but they just tinker with it, they try it, and they say what works and what doesn't work. So we managed to see how it works and to find all the resources for that. I talked to the colleagues from Israel, and it's very and of course it's important to be in the safe space, but this psycho-emotional stabilization is a strong side which helps adapting and moving on. And I appreciate the WHO for providing the support, for giving this tool and method. And we will incorporate this feedback from the participants to
Thank
further improve the tool.
Yeah, I'll just say something which is just, it was amazing to hear Galyna's talk there and just be reminded of the incredible work that the colleagues have been doing. I mean, it really was quite something to translate Self-Help Plus. It's an easier package to implement than other psychological interventions, but it's a harder one to adapt because it's of all the pre-recorded audio. And we did it really quickly and translated everything really quickly. And then to see the scale up has been unbelievable and incredibly impressive. So I think thank you to everybody who's been involved with that. And I really would just, I think for me, the proof in it is some of the feedback that we're getting from the courses about people saying that they're finding it helpful. So I really would just encourage everybody to just have a look at the book, download it, have a listen, see how you can use it. And I just also mentioned about the reluctance sometimes of people at the beginning. It's very true, and we've seen this in many places, that at first people are quite cautious about the idea of a pre-recorded audio, but it works. We've seen it work now in many places, and it's working across Ukraine. So I think that's really good to see.